So if you're noticing skin around your eyes are looking looser, perhaps a bit crepey, you're not imagining it. But it doesn't automatically mean you have to have surgery. There are now some excellent non-surgical treatments that can make a real difference with loose, thin skin and even eye bags. I'm Dr. Owen Thomas, I'm an aesthetic doctor in London, and in this video I will explain why your eye area looks tired even when you're not, whether under eye filler is right for you or likely to make things worse, and what genuinely works with crepey skin, with realistic timelines so you know what to expect. Let's start with what's actually happening beneath the surface. So the skin around your eyes is the thinnest on your entire face. It's a fraction of the thickness of the cheeks or the forehead, and that matters enormously when you're choosing which treatments actually help. When you're young, the thin skin is supported by a dense network of collagen fibers that provides strength, plus elastin, which gives bounce. But from your late 20s onwards, you're losing roughly 1% of your collagen every year. The elastin fragments, so skin becomes a bit more translucent, which is partly why dark circles appear. You're literally seeing blood vessels through thinner skin. The texture changes, becoming crepey rather than smooth. And because the supporting structure has weakened, the skin doesn't snap back. A 2025 study found that collagen-stimulating treatments improved skin beyond where they were placed. The under eye area responded as a whole structure. So when we rebuild collagen here, we're restoring the tissues that hold everything together, not just filling space. When assessing the eye, we decide whether you need volume, collagen rebuilding, or tightening, and quite often a combination of all of these. So let's talk about rebuilding the lost structure. So if the core problem is thin, collagen-depleted skin, the logical starting point is treatments that rebuild the skin quality from within. You might have heard of polynucleotides. These are frequently used around the eye area, DNA particles that activate the skin's repair pathways. They're not acting volume, but they're signaling cells to produce more collagen. Evidence shows that they brighten the under eye area and can help fine lines modestly. A study of 120 patients combining polynucleotides with Morpheus 8 found that there were significantly better results for wrinkles and skin firmness at 6 months with both. However, on their own, I find that they're pretty modest, and for that reason I like using them with other treatments. 4 sessions, a couple of weeks apart, minimal downtime, some swelling for a few days, and possible bruising. Results can look natural, but they're certainly not going to be dramatic with polynucleotides alone. Skin boosters like Sunacos and Jalipro work similarly but differently. You combine hyaluronic acid with amino acids. These are the building blocks that your skin needs for collagen and elastin. A 2023 Sunacos study showed under the eyes there was significant improvement in dark circles and wrinkles after 3 sessions. Skin thickness increased, and that's exactly what you want. Results appear within weeks and last at least 6 months. Sculptra, however, is more powerful, but there's a caveat. It usually isn't injected directly into the lower eyelid skin. It's quite thin, and any little tiny nodules from Sculptra would show through. So improvement with Sculptra develops over 2 or 3 sessions, 6 weeks apart, and that lasts 2-3 years or more. It's much more powerful than Sunacos, Jalipro, and certainly polynucleotides, and it's a great option for facial rejuvenation. Make sure if you have Sculptra that your injector goes as close as safely possible so that the effects benefit the eye area. Next, how do you tighten the skin? So when it comes to tightening, lasers and energy devices can be genuinely effective, but it's important to understand the different approaches and types. So what we call non-ablative lasers deliver controlled heat into deeper skin layers without damaging the surface, and that causes contraction of the collagen fibers and stimulates new production. A photoner laser study of about 30 patients showed significant improvement in eye wrinkles lasting over 12 months. Doctors assessing the before and after photographs without knowing who was who identified the correct after photo in 100%. Biopsy studies also showed that there was multiple different types of collagen increasing significantly, and the deeper skin layer became much thicker. So this non-ablative laser treatment feels like warmth around the eyes, mild redness and slight swelling for a day or 2, and perhaps light flaking or peeling. 3 to 4 sessions, a month apart, and then results developing over 3 to 4 months. That works well for early to moderate looseness, maybe in your 30s and 40s. Photoner Smooth Eye is a non-ablative laser with evidence to actually even reduce eye bags through heat alone. 30 patients in one study applied this from inside the lower eyelid, targeting deep down onto the fat pads directly, and after 3 sessions, 87% of people were really satisfied with bag volume, wrinkle severity both reduced, 0 downtime. Ablative laser, however, takes things a step further. Instead of just heating, leaving the surface intact, it actually removes the outer layer, and that triggers intensive healing. More collagen, much more tightening, and more dramatic results. But there's downtime, up to 10 to 14 days with CO2 lasers. I use erbium laser, which is half that time. Either way, it's not a lunchtime procedure, but for deeper etched lines or significant skin laxity, it achieves results that gentler approaches just can't match. If we're talking about the most powerful option for wrinkle reduction, then CO2 laser has the edge. One study showed about 90% reduction in wrinkle depth, with 87% of that improvement still present 2 years later, and that's genuinely impressive for a non-surgical treatment. Erbium is a close second in terms of results. Over 90% of patients in one study showed obvious to marked improvement after 2 sessions. The slightly less aggressive treatment with erbium is that it heals faster because there's less heat damage. You get precision without as much inflammation, which is why I tend to prefer it for the eye area. With laser, there's an important consideration for skin type. If you've got darker skin type, that's South Asian skin or darker, ablative lasers carry more risk of pigmentation changes, and erbium tends to be safer than CO2 in this regard, but you still have to discuss this with your practitioner and check that they've got the right settings and experience. Endolift takes a different approach. This is a thin laser fiber beneath the skin, tightening from inside with hot temperatures. And that's great when someone's got skin looseness, but also fat bulging. One study with Endolift showed that increased thickness and elasticity under the eyes. 90% in that trial showed good to very good improvement at 6 months. Endolift is minimally invasive. There's not much downtime. The key is matching the right approach to what's actually causing the concern, which brings us to the most common and controversial treatment under the eyes. So what about tear trough filler? Should you consider it or avoid it entirely? It really depends on what's causing your concern. So as usual, filler helps when the main issue is true volume loss. That's where you've got a hollow tear trough, bone and fat changes have created a sunken depression. If you've got good skin quality and isolated hollowing, it could be ideal. A small amount placed carefully can soften the shadow. It can go wrong if the skin is thin and crepey. Filler tends to make things worse. The product can show through and that creates a bluish tinge discoloration. Because it attracts water, you get persistent puffiness because the lymphatic drainage isn't so great. And fundamentally, filler adds volume and it doesn't improve skin quality. So for most people, unless you've got great skin and you've got a deep hollow, it's important to address skin quality first. Rebuild the collagen, improve the thickness and firmness, and then you can reassess. And many people find that once the skin is stronger and more youthful, then they don't actually need fillers in the first place. If filler is appropriate, then always use small amounts, micro boluses, precisely placed, and someone who knows what they're doing with the anatomy, ideally with ultrasound guidance. Now let me give you a practical guide on how I would treat the under eye area. So if you're in the early stages, perhaps your early 30s, you're starting to notice first signs of change around the eyes, then simply polynucleotides with some skin boosters like Sunacos or Jali Pro are a great starting point. They build skin quality gradually, and good skincare and sun protection alongside that preserve existing collagen. As things progress, you could look at non-ablative lasers, maybe even just once a year as you get towards your 40s. Once you get more moderate concerns, crepey texture, laxity, dark circles, and a combination starts to work best. Biostimulators, initially you could use the more moderate stimulators like Sunacos alongside the non-ablative laser for tightening, working together over 3 to 6 months. If you're having more general skin changes or volume loss, then sculpture would be ideal, and placing that near the eye for more significant collagen building. Once you get more notable advanced changes, you get looseness, fat bulging, and deeper textural concerns, then Endolift could be great if you've got bags, or ablative laser if texture and looseness is a major factor. Filler only after skin quality is addressed, and only if you've got genuine hollowing that remains. For a small minority with excellent skin quality, filler could even be first line. So whatever stage you're at, ask your practitioner, what is actually causing this? Is it skin quality, volume loss, or both? How many sessions and over what time frame? And what's realistic for my starting point? It's going to be difficult to deliver dramatic instant transformation, so just be careful if anyone's promising that. So the eye area improves gradually as collagen rebuilds, but that gradual improvement looks natural, and that's exactly what most people want. So crepey texture doesn't just affect the eyes, it can affect the neck, chest, arms, above the knees, and these areas all lose collagen in the same way, but each needs a slightly different approach. Some treatments that work brilliantly around the eyes just aren't suitable for the body, and vice versa. There's one area in particular where people tend to waste the most money on treatments that simply don't work. In the next video, I'll show you what actually does work. So if you want to check that one out, and I will see you in the next one.